time. I would like to turn now, Mr. Speaker, and recognize the gentlelady from Texas, Congresswoman Sheila Jackson-Lee.
Thank you very much. Let me thank the conveners of this special order and express my appreciation to Mr. Horsford and to Mr. Jeffries for continuing to educate our colleagues on extremely important issues. And I'm delighted to join the Congressional Black Caucus as it proceeds continuously to ensure that we advocate for those who cannot speak for themselves. I want to take up an issue that has struck home and is being confronted by states, some of whom are in the South, and some are in other places throughout the nation. I was very pleased to stand with my fellow Democrats and support the Affordable Care Act. I could go through the journey of 2009 and 2010 when many of us spread out across the country and confronted misinformation through town hall meetings, controversy, and conflictedness. And I think that what should be continuously emphasized is the President's leadership on one single point, that although health care was not listed per se in the Constitution, it should be a constitutional right. And if you read the words or quote the words of the Declaration of Independence, we hold these truths to be self-evident, that we have certain inalienable rights of life, liberty, and the pursuit of happiness. One might argue that education and health care fall into those provisions of life, liberty, and the pursuit of happiness. It was in the context of that framework and the original words of the Constitution that as you open the book that has the provisions of the Constitution, the opening phraseology indicates that we've come together to create a more perfect union. I think the Affordable Care Act was intended to try and lift the boats of all people. And interestingly enough, major hospitals across America were clamoring for the passage of this legislation to really do what we are speaking about, which is to cut into the health disparities, because our hospitals across America were suffering from not being reimbursed on uncompensated care for those people who came without insurance. Many of them included African Americans who suffered in larger numbers from the difficulties with diabetes, for example. And Texas, which is now in the eye of the storm, is one of those states that has rejected the expansion of Medicaid, which goes to the very point of increasing opportunities for those who suffer disparities so that they can have access to health care. And that is largely the problem here in Texas. Federal funding for adult expansion far exceeds current local expenses for unreimbursed health care costs. Having 3 years without any match whatsoever, and then having the ability to have a very small match later on. It is estimated that Medicaid expansion would generate more than 231,000 jobs in 2016, 1.8 percentage point reduction in the state's current unemployment from 6.1% to 4.3%. And it would directly address the disparities in diabetes, heart disease, and HIV/AIDS, in partnership with our federally qualified health clinics, which many states have seen expanded because of the Affordable Care Act. And now, in my own home state, in my city in particular, Central Care has now put more community health clinics in areas where disparities were severe and lives were being lost. It benefits children as well. And I'd like to cite some numbers here for my colleagues to indicate what we would benefit from by the expansion of Medicare. Unreimbursed health care costs for charity care in 2010 for an estimated $4.4 billion is in unreimbursed expenses. We would be covering that. We'd also get off the #1 list, Texas #1, ranking among states with the greatest share of uninsured residents at 23.8% in 2011, more than 6 million people compared with the national average of 15.7%. And then, as I indicated, we would, again, eliminate the opportunity for low-income adults to be able to secure care. When low-income adults don't get care, their children don't get care. And so I am suggesting that the rejection by Governor Perry, along with other governors, to not accept expanded Medicaid has a direct impact on the increase not only of the uninsured, but the increase in the numbers of those suffering from certain diseases who cannot get care, and therefore, rather than have preventative care, which an expansion of Medicaid would provide, allowing for doctor visits, then the only time that we are able to secure health care for them is when they arrive in the cities and the counties and the states' emergency rooms, where we see a surge in emergency room costs, health care costs, and we eliminate the goodwill and the good intentions of a very good bill that answers the question, are we attempting to form a more perfect union by establishing a framework of insurance for all Americans, hard-working Americans, Americans of Asian descent and African descent and Hispanic descent who have different DNA and cultural indices that would lead them to have certain diseases more than others. Let me also take note of the fact that one of those particular diseases that impact the African American woman in more devastating manner than in others, and that is triple-negative breast cancer, that impacts Hispanic women and African American women and Anglo women, but more so in the African American community. That kind of diagnosis gives, in this current phase of time, a short and almost devastating diagnosis, one that is difficult to recover from, one that sees an increase in the loss of life. So I would make the argument to Governor Perry and to governors across the nation who have rejected the expanded Medicaid as a budget issue, as a political issue, as a I'm going to stand up to the president issue. You are wrong. You're absolutely wrong. Because this is not a political issue. This is a life and death question. And I want to applaud governors like those in Florida who certainly obviously may not welcome the applause, but I think it's important when people stand on principle or what is good for others that they should be applauded. So I applaud the governor of Ohio and the governor of Florida for moving forward on Medicaid expansion, and I would say to my good friend who is leading this very important special order that we need to begin to work with the president to find ways to substitute the rejection of the Medicaid expansion so that individuals that are in these states who cannot speak for themselves, who in actuality have a head of state, a governor, that is making a political decision, a simple political decision, will not lose out on the benefits intended by the Affordable Care Act, which is to give comfort and to give help and aid to those who need health care. I finish on this note. I want to thank Dr. Christensen, because when we began to write this legislation, it was a Congressional Black Caucus that talked about the health care disparities, which were the premise of the fact of expanding health care, and it would be a shame if after all this work and passage of this bill, there'd be innocent persons in our respective states, like Texas, that could not benefit from something that could save lives. I thank the gentleman for yielding, and I yield back to the gentleman.